Hello there. I'd like to introduce myself. My name is Julie Carden. A lot of you will know me from the Come Enter Life and the Breastfeeding Cafe, which in these uncertain times is closed at the moment. So I'd like to introduce myself. I am a registered nurse, registered in the early 80s, so I'm a bit ancient. I was a registered midwife for 25 years, and now I am a lactation consultant, international board certified, and a tongue-tied practitioner. I work in the NHS and privately, and run the voluntary breastfeeding cafe at Come Enter. What I'd like to do over the next little while, few days, is just share with you via a vlog some breastfeeding tips. It'll be something each day, hopefully. It would just be a couple of minutes, but what I notice is that I'm often giving the same advice to people, and that support is not going to be there at the moment with the NHS as it is. So I'm hoping that this will be helpful for you. I'm very happy to do a face-to-face remotely via FaceTime or WhatsApp. Please do just get in touch. My details are on the Come Enter Life website, so that might be a way forward as well. So what I'm going to talk about today, my little tip for today, is skin to skin. So skin to skin, what it actually means is stripping a baby down to the nappy and holding your baby up against your bare chest. As mums, this is great for dads too, but this is specifically for mums that I'm talking about today. Skin to skin is really useful for those early times, obviously after baby's been born. If you get a chance, do look up the birth crawl, because this is it's just beautiful to see. Babies will, if able and allowed, and no maternity drugs, etc., they will be able to crawl to the breast within that first hour and suckle. So, and it's beautiful to see. Skin to skin, sort of, it just comes from that. It's really useful if your baby is very sleepy in those early days and doesn't want to breastfeed. Skin to skin against your bare chest, and you can cover in a blanket or a dressing gown or under a jumper, whatever, and do it for hours. That's really good, and your babe may then sort of start to wake up and head towards that breast. Another good time for skin to skin is if your baby is particularly unsettled, very fractious, crying. Then skin to skin can be really helpful to calm both mother and baby. It helps, research has shown it slows the heart rate, brings blood pressure down in both mum and baby, and it regulates baby's temperature if baby's too warm or too cold. So that's really good. And if baby is not latching and is too cross, then skin to skin in the bath can work wonders, and it can help a babe to go on when a babe wouldn't normally. Skin to skin can also be brilliant for people who are bottle feeding. You can get that closeness as well, which is the most important thing with your baby. And of course, dads can do it too. Right, so that's my little tip for today, skin to skin. And hopefully I'll see you again tomorrow. Bye for now.